Dear audience, dear colleagues, in the next few minutes, I'd like to introduce you the new horizons on the prediction of preeclampsia. So first about me, I'm David, I'm an OBGYN resident, a PhD student, and together with my great supervisor, we would like to reduce the maternal and fetal morbidity and mortality. And our mission is to provide proper and early diagnosis and treatment for severe preeclampsia. And in order to achieve that, we have two specific projects that we have started this autumn. As you can see, both of them are concerning preeclampsia. About preeclampsia, it's a very important pregnancy complication that affects almost 5% of pregnancies worldwide, and it accounts for almost 500,000 fetal deaths and more than 50,000 maternal deaths per year. It's important to mention what is preeclampsia exactly. We can define this disease with a form of hypertension. It can be either a mild or severe form clinically, and we have to have some form of end organ damage. We can either see in the maternal labor parameters or symptoms that the mother has some proteinuria or other type of end organ damage parameters, or there is something wrong with the fetus. Mainly it can be retarded or some kind of other parameter can be in deficit. Now we are concerning about the severity. The severe form of preeclampsia, of course, it means more complication and more severe symptoms. And to this day, we have no available predictive value for this severity. That means, of course, different follow-up, different hospitalization rate, and in the end, different pregnancy outcomes. That's why, for our first project, we would like to investigate the predictive value of microRNA 210 on the severity of preeclampsia in pregnant women. But what is this microRNA exactly? In general, we have to mention that the exact pathogenesis of preeclampsia is still unknown. We know that some form of malperfusion, hypoxia, and oxidative stress is present. And here comes this small single-stranded RNA that is hypoxia-induced, and the levels of this microRNA can be measured with two different types of analysis methods. And this 210 type has the most literature evidence and potential to be our first microRNA biomarker. We already know that this contributes to the pathogenesis of preeclampsia, and the elevated levels could associate and predict the severity. And that's why we would like to investigate this predictive value. So for a clinical question, of course, we asked if these elevated levels are associate or can predict the severity of preeclampsia. We observe pregnant women, of course, and we can see if the different severity forms compared to the control have different elevated microRNA levels. Of course, the more elevated, the worse will be the severity and the prognosis. And it has a very important clinical and research implication. We could include these parameters in the risk assessment tool, and we can get a predictive value. We could use these microRNAs to predict the severe preeclampsia much more accurately. For the final research, for the final search key, we conducted it in 5 databases on 21st of November. And with this, we could found almost 800 articles. We did our selection, and in the end, with my pair, we found 21 eligible full-text articles for further investigation. For the progress, you can see that we are already working on the data extraction. We are 75% done with that. So hopefully we will finish it as soon as possible. And for the second project, we would like to investigate the free fatty acid levels as protective or risk factors for preeclampsia in pregnant women. So again, I've already mentioned that preeclampsia has an unknown pathogenesis. We know that oxidative stress is higher, and lipid peroxides and the byproducts will be elevated, and these fatty acid levels will differ. and it will cause, at the end, some form of endothelial dysfunction. It's important to mention that other more known lipids have already been investigated, and we need, of course, more studies for them to be included in the risk assessment tool. Just a few words about these free fatty acids. In general, we can differentiate between saturated and unsaturated fatty acids. The saturated ones are the pro-inflammatory fatty acids, and they are in connection with placental ischemia and hypertension. And the unsaturated ones are PUFAs and MUFAs. They are usually anti-inflammatory fatty acids. They can be monosaturated or polysaturated. And their role is still a bit uncertain, but we know that they are contributing to the pathogenesis of preeclampsia. And depending on which fatty acid we see and check, the elevated or the decreased levels can be protective or risk factors for preeclampsia, and they can be also a new element of this risk assessment tool. And also we can think about risk-reducing supplementation with some form of vitamin, for example. So, for our clinical question, we want to see if different serum or plasma free fatty acid levels serve as protective or risk factors for preeclampsia in pregnant women. Of course, regarding the articles, they are usually comparing preeclamptic pregnant patients with non-preeclamptic, and of course the serum or plasma fatty acid levels will be different. And it has also a great future implication. They could be used for risk assessment tools also, and they could serve as potential new supplementation targets. We have a preliminary search. We have done this search in 3 databases, and we found 4,000 articles. Just to show you the most important key articles, you can see that they check healthy and preeclamptic patients, and depending on which free fatty acid level we check, they can be elevated or decreased in preeclamptic patient, depending on its anti-inflammatory or pro-inflammatory free fatty acid. To summarize, we would like to make these projects, these dreams come true in 2025, hopefully as soon as possible. And we talked about prediction a lot during these minutes, so I would like to end my presentation with Abraham Lincoln's quote: "The best way to predict your future is to create it." Thank you very much for the attention.
Thank you, David. And as your supervisor, it's a great honor for me that I can open the discussion. We are waiting the questions.
Congratulations for your progress. I'm not familiar with this field, so I just would like to ask that when or in which phase does the PE progress or appear?
So by definition, we can only say that it's a preeclampsia after the 20th week of gestational days, so weeks. So after the 20th, and you need a form of hypertension measured 4 hours apart at least twice, and some form of end organ damage, either in the mother or the fetus.
Brilliant presentation, first of all. And I would like to ask, what is the average cost of these microRNA analyses in clinical practice?
Yeah, it's a good question. There are different methods, and I don't have the Hungarian value for that, but I saw in a 4-year-old article that they done these microRNA analyses, $40 US per analysis. It's not cheap, but it's not that much. 4 years ago it was like that. Today's price, I don't know.
Thank you very much.
Well, I have several questions, but nobody knows the answer. Well, I would like to suggest that the preeclampsia is one of the diseases that terrorist diseases, and we have only 1 or 2 types or issues to investigate, but I think that there are much more topics on this the disease to discover. And I would like to highlight that this could be one of the most important, because the microRNA is in the focus nowadays, and I hope that David will be successful in this topic.
Thank you. So it's important to mention that this year's Nobel Prize for Medicine went to the discovery of microRNAs, so it's a hot topic for sure.